Hi, Dr. Durgan. That's a movie.
Good afternoon. While we are waiting for phones to dial, we want to just share some reminders to our Madison VA veterans of important resources available and updates. First, on July 16th, 2022, the Veterans Crisis Line changed to a new, shorter number to directly address the need for ease of access and clarity in times of crisis, both for veterans and for non-veterans. To reach the Veterans Crisis Line now, just dial 988, then press 1. The crisis line is available 24 hours a day, 7 days a week, 365 days a year to provide confidential crisis support to veterans and their loved ones. We may still see materials advertising the previous number. That number will remain active. We also want you to know that we are offering COVID vaccine and the new bivalent COVID-19 vaccine booster appointments. If you've not already done so, please make your vaccine or a booster appointment today by calling us at 608-280-2160. We are also encouraging our veterans to get current updates from the Madison VA by signing up for our automatic email updates. If you visit our internet site at www.va.gov, Madison Healthcare, you can scroll to the bottom of the page and subscribe to our healthcare news and announcements. You'll at least get our quarterly newsletter, plus you'll get news releases and other communication products as we release them. And last, we also are encouraging veterans to like our Facebook page, where we routinely provide national and local updates about what is happening at the VA, including events like this teletown hall. We'll pause for a second and go through those one more time, and then I think we'll have dialed all of our stakeholders. So thanks for holding. All right, if you're just joining, we are waiting to dial all of the veterans for attendance at today's town hall. And while we're waiting for the phones to dial, we are going to just repeat some announcements we wanted to share with you. First, on July 16th, 2022, the Veterans Crisis Line changed to a new, shorter number to directly address the need for ease of access and clarity in times of crisis, both for veterans and for non-veterans alike. To reach the Veterans Crisis Line, dial 988, then press 1. The Veterans Crisis Line is available 24 hours a day, 7 days a week, 365 days a year to provide confidential crisis support to veterans and their loved ones. You may still see materials advertising the previous number. That number will remain active. We also want to let you know that our VA is offering COVID vaccine and the new bivalent booster COVID-19 vaccine booster appointments. If you've not already done so, you can make your vaccine or booster appointment today by calling 608-280-2160. We're also encouraging veterans to get the most current updates from our VA by signing up for our email updates. If you go to www.va.gov/Madison Healthcare, you can scroll to the bottom of the page and subscribe to our healthcare news and announcements. You'll get our quarterly newsletter, press releases, and other communication products as we release them. And last, we're really encouraging veterans to like and sign up for notifications on our Facebook page. We routinely provide national and local updates about what is happening at our VA, including events like this teletown hall. Well, it looks like we are done, or very, very close to done, dialing veterans, so we are excited to get started with you all this afternoon. Good afternoon and welcome to Madison VA Hospital's live telephone town hall. Today we'll provide updates on the COVID-19 booster and seasonal flu shots, and we'll also review the recently passed PACT Act legislation. We also have an important announcement that we will share with you from our leadership team. My name is Abe Rabinowitz, and I'm the Assistant Director of the hospital, and I'll be moderating this afternoon's call. Today we're fortunate to have a panel of Madison VA's leadership team here to answer questions. This includes our Acting Chief of Staff, Dr. Chris Hildebrand, our Deputy Associate Director of Patient Care Services and Vaccine Coordinator, Christy Esch, our Chief Mental Health Service, Dr. Tim Jurgens, our Acting Deputy Chief Patient Administration Services, Amy Morse, and our Chief of Social Work, Stephanie Schilling. So we do hope you stay on the line with us this afternoon, and we encourage you to participate in the question and answer session that will follow. If you would like to ask a question, all you have to do is press 0 on your phone, and you'll be connected with a staff person who can take your question and put you in line to speak with our panel. You can begin to call in with your questions now, and we'll hold and begin to answer them after the announcement section of the town hall. If you do get cut off, unfortunately, there's not an easy way to rejoin, so please do stay on the line. If you do get disconnected, please know that we post these recordings on our internet site where you can listen to them at another time. So first, we want to start this telethon hall off with a special announcement. And today, I am sitting in for our director, and I want to thank you on his behalf for joining us on the call today. I am very happy to share recent news that our Madison VA Hospital has won VHA's National Award for Best Overall Experience. This means that over the 150 VA hospital systems nationwide, our VA was awarded for providing the best overall experience to all of you, our veterans. It is a true honor for all of us to provide all of our veterans with exceptional health care services and to provide the best veteran experience we can every time you walk through our doors. This award used results from surveys of inpatient experience, employee experience, all employee survey results, and customer trust scores to rate and rank each hospital. As a finalist for this award, we were also asked to submit a narrative to support our team, and our staff knocked it out of the park in describing the work we've done in an attempt to exceed your expectations as a veterans healthcare organization. And we're especially proud to earn this award during such a challenging time. With the changing dynamics of the pandemic, the impacts on staffing, and the overall stress caused by providing healthcare under such trying circumstances, it means so much to be recognized for providing you with excellent healthcare services. Our team here at the Madison VA is driven by our mission of service to veterans, and this award reflects the efforts of our team every day to work hard to meet your expectations in that mission. It means a lot to be recognized with this award. It means more that a portion of that success was earned by the feedback that you provided to us. Thank you for sharing your experience and supporting our team so we can deliver results for you. We say and believe that this is the best mission in government. We don't make the efforts we do every day to win awards like this, but I can tell you it feels good to be recognized and to share congratulations with all of the members of our team here at the hospital, with our stakeholders, our broader community, and with all of you. So we're so proud to share this news with you today. Thank you for choosing us as your healthcare provider. We look forward to our next opportunity to serve you. So thank you again for your attention today and for joining us on this call. We have a few more announcements, some interactive questions, and then we'll look forward to answering your questions. So you can begin asking questions by dialing 0. And while you're doing that, I want to introduce Christy Esch, our Deputy Associate Director for Patient Care Services and our Vaccine Coordinator, to provide a quick update on COVID boosters and seasonal flu vaccinations. Christy.
Thanks, Dave. Well, COVID precautions are loosening in the community, and our experience is showing low levels of hospitalization and death. We do continue to see high transmission rates of COVID throughout all of our communities that we serve. In fact, this week, all of the counties in our service area are showing up as high on the transmission scale. As a healthcare organization, we use these rates to determine our safety precautions, and with a consistently high transmission rate, we're still following our standing COVID safety protocols across our hospitals and clinics. Those high rates of transmission are also why we continue to strongly encourage that veterans are vaccinated and current with their booster shots. We know that vaccinations do not provide a guarantee that you won't get COVID, but we also know that they protect you against major illness and are a big reason why we are seeing a sharp reduction in hospitalizations and mortality with these new variants. And now we're happy to announce that we're offering veterans the new bivalent COVID vaccine. The bivalent vaccine means that it's designed to target 2 different viruses, the original COVID virus and the Omicron variant. As we enter the fall and winter and return to the indoors, it's a good time to make sure that your vaccine and boosters are current. At this time, everyone 18 years and older that has received an initial vaccination series and is at least 2 months out since their last vaccination or booster shot is eligible for the Moderna booster that we have here at the VA. To make an appointment, please call our vaccine hotline at 608-280-2160. Thank you for considering getting boosted this fall. I also want to make sure that you're aware of a recent VHA initiative to offer COVID-19 antigen tests or at-home kits to veterans when you visit our outpatient clinics. If you come into any one of our clinics for care, please know you can ask for a home antigen test kit. This actually includes 2 tests to help you assess symptoms of COVID-19 from home. The kits include instructions for what you should do and who you should call if your test is positive. We encourage you to take advantage of this resource and opportunity to help us identify and stop the spread of COVID-19 the next time you visit. Last, I want to remind all veterans that we're approaching the season for vaccination against the flu. Beginning this week, we're offering seasonal flu vaccine opportunities at our main hospital and all of our clinics. At all of our outpatient clinics, we do have appointments available Monday through Friday. And then here at the main hospital, we have walk-ins available if you're not able to get that vaccine at your appointment. We also want you to know that if you're unable to get to a VA location and have received care through either a VA or community care provider within the past 24 months, you're eligible to get a flu vaccine at an in-network pharmacy. To find out more about that, you can call 877-881-7618 or go to www.va.gov/communitycare/flushot.asp. It's important to note that the flu vaccine is different than the COVID vaccine, but also a very important defense to keep you free from influenza this season. You are able to get both vaccines at the same appointment. If you have other questions, please reach out to your primary care team. Thanks, Abe.
All right. Thanks, Christy. And before we move to the next section of our town hall announcements, we wanted to share a couple of questions. It's always good for us to get a feel for who's in the audience and kind of where you currently stand on vaccination, boosting, and this just helps us understand our audience and messages that we deliver to you. So we have this capability to ask you questions over the phone, and then for you to respond by using the numbers on your phone to give us feedback. The first question we have is if you could just let us know your vaccination status. So you can press 1 if you're not vaccinated, you can press 2 if you're vaccinated but not boosted, and you can press 3 if you're vaccinated and fully boosted. So we're seeing a pretty overwhelming number of folks out there who are vaccinated and fully boosted, so that's great news. The second question we have is we want to know whether you plan to get the new bivalent COVID-19 vaccine. So press 1 if you plan or have already received the COVID bivalent booster, and press 2 if you do not plan to get the new COVID bivalent booster. We're seeing about 80% of you that have already received or are planning to receive the bivalent booster, so that's great news. For those of you that are not planning to get the COVID bivalent booster, we want to understand a little bit about what's preventing you from doing so. Press 1 if you believe that the pandemic is behind us and that COVID is not a serious health risk. Press 2 if you're concerned about side effects from vaccination, and press 3 if you're not sure about how to arrange a vaccination appointment. Okay. So as we're getting answers in, we're seeing that we do have some folks who are concerned about side effects, and others who, about 25%, who are not really concerned about COVID anymore, and about 30% who aren't sure how to make a vaccination appointment. So we want to make sure that we reiterate that you can call right now, 608, or after you stop listening to the call, write down That number again, 608-280-2160. That will take you to our vaccine hotline, where you'll be able to talk with one of our staff about making an appointment for the new bivalent COVID booster or for your initial vaccination if that's what you need, and we'll make sure that we take care of you right away. Thank you all for your feedback on that. It's very much appreciated. The next thing that we want to cover before we get to your questions and answers is information about the recently passed PACT Act, which greatly expands benefits and healthcare eligibility with a focus on the impact of toxic exposures. And we have Amy Morris, our Deputy Chief of Patient Administration Service, here to provide an update. Amy.
Thank you. We want to make sure all veterans are aware of the recently passed Promise to Address Comprehensive Toxics Act of 2022, or PACT Act. The PACT Act empowers the VA to provide much-needed benefits and care to generations of veterans who are exposed to toxic fumes and other environmental hazards while fighting for our country. This legislation represents a substantial expansion of veterans' benefits and eligibilities for enrollment in VA healthcare. It is important all veterans understand the new authorities it provides. Specifically, the PACT Act will empower VAs to deliver benefits to veterans suffering from more than 20 toxic exposure-related conditions and to their survivors, make generations of veterans with toxic exposures eligible for VA health care while increasing care for many more, ensure that every enrolled veteran receives an initial toxic exposure screening at VA and follow-up screening at least every 5 years, solidify our process for establishing presumptions of service connection of toxic exposure-related conditions, which puts one goal above all else, getting veterans the benefits and care they've earned and deserve. Enhance training on toxic exposure for VA healthcare and benefits staff, and support research studies of the mortality of veterans who served in Southwest Asia during the Gulf War, post 9/11 veterans' health trends, and veteran cancer rates. The Act also expands eligibility for post 9/11 combat veterans, authorizes VA additional hiring flexibilities to help build a stronger, more skilled workforce to meet the growing demand for benefits and services, authorizes 31 new medical facilities across the country, providing greater access to VA health care. If you are concerned about toxic exposure and want to learn more about the PACT Act, we highly encourage you to review the VA website at www.va.gov. Scroll to the bottom and look for the PACT Act button. You can also call 1-800-MY-VA-411. The website is filled with useful information and links to help you explore how the PACT Act may impact your benefits and eligibility for health care services. It includes several helpful frequently asked questions and easy links to file a disability claim or apply for VA health care. The frequently asked questions are separated into useful categories so you can search for answers for how the PACT Act applies to Gulf War or post 9/11 era veterans or Vietnam era veterans. We are encouraging all veterans and survivors to review the website, talk to your county veteran service officer, or call the VA to investigate their benefits and eligibility for health care under this new authority. As veterans on this call, we also want to make sure you share this information with other veterans you know who may be eligible for these new eligibilities. If you know a veteran who you may now be able to connect to VA services under this authority, we appreciate you taking the time to educate and encourage them to seek benefits and healthcare services they have earned. We will do our best to advertise this to veterans who are not currently enrolled in our care, but one of the best means for creating awareness is through personal contact. Any information you can share with a veteran who may be eligible for benefits or services under the PACT Act will help. Thank you for your partnership in assisting us to ensure all veterans are aware of these services and have the resources they need to apply for the benefits and services they have earned.
Well, thanks very much, Amy. And, that's a lot to go through. There's a lot of different authorities in the PACT Act. I think if there's anything that we want all of you to take away is that this is a really significant expansion of benefits, particularly around toxic exposures. So we're really encouraging you, if you have those concerns, to visit the website and learn more about the PACT Act. We know it's not easy to communicate this all over the air verbally, but there are great resources available. And also, as veterans, you may know veterans who don't come to the VA for care or have these kinds of concerns. And we really want to let everybody know that there are expanded eligibilities and opportunities that are there for them to investigate. So please do help us spread the word. We do have a couple of other polling questions just to try to understand a little bit more about your understanding of the PACT Act. The first one is, after hearing about the PACT Act on this call, please let us know if you would like to receive more information on the PACT Act. Press 1 if you feel like you already understand the PACT Act and know where to go for more information. Press 2 if you have a basic awareness of the PACT Act but you want to hear more. And press 3 if you don't really understand the PACT Act or how it may impact me or my fellow veterans. Okay, questions are coming in. We have it's actually split about 33% for each, with people who have basic awareness and want to hear more. A large percentage of you already are saying you understand it and know where to go. That's great news. And then there is about 40% that don't really understand, and I guess those are folks that we would really want to point you to our website as your primary source, or call your county veteran service officer, or call those national numbers to learn more about your eligibility. Our follow-up question for this is just to help us understand the best way to communicate with all of you. If you reply that you want more information about the PACT Act, how would you best like to receive that information? Press 1 if you'd like to receive information through the mail. Press 2 if you'd like to receive information through an e-newsletter or an email. Press 3 if you'd like to learn more by reviewing a website, or press 4 if you'd like to learn more by attending a community meeting. Okay, as we're getting responses here, we're seeing a lot of folks that would like to get something in the mail. Many who like to get it through a newsletter or email, and that is a great reminder. If you do want to sign up for our quarterly newsletter, we're about to release another one. You can go to our website at www.va.gov, Madison Healthcare, and if you scroll to the bottom, there's an option to register for updates from the VA. That's a great way to get routine email updates about what's happening at the hospital, including information on the PACT Act. All right, well, thank you very much for answering our questions. We really appreciate it. And now we can move on to the question and answer session of the town hall. So thank you for waiting and allowing us to share that information with you. Our first caller is James from Janesville. James, would you like to share your question?
Yeah, one of my questions was about eyeglasses. I wonder if I just can get them locally rather than going to Madison. Just if I call and make an appointment with the local ones that have been doing it, if I just get a voucher for paying for that, or a way to go on that.
Hi, James. This is Stephanie. I'm the Chief of Social Work. Thank you for calling. That's a really great question. What I'm going to recommend that you do is talk to your primary care provider and get a consult entered for eyeglasses through the VA so that we can do your routine eye exam. And then sometimes we don't have appointments available in a specified amount of time, and then we can send people to the community. However, you really do have to go through your primary care provider first and get authorization for that. So that's what I would recommend you do for eyeglasses. and also routine hearing exams as well. So great question. Thank you.
All right. Thank you, James. Our next question is from Kathy. Kathy, you have a question about COVID vaccinations. Go ahead.
Hi. I've been vaccinated and I had all 3 shots. I just wondered if I'm eligible for a 4th shot and do I even need it? And my other question was, I have expired COVID tests at home. Are they still good or should I just throw those away?
So thank you. This is Dr. Hildebrand. So the new vaccine covers the new variants of the virus. And if your if the 4th vaccine you had, or the 3rd vaccine you had is over 6 or 8 weeks ago, you are eligible to get the new one, and it should confer even better protection for you. So the recommendation would be yes, to get the 4th vaccine. Regarding expired tests, we're kind of required by the FDA to recommend not using expired equipment, and so I would recommend that you get new ones.
And then just as a reminder, and Christy mentioned it earlier, when you do come to one of our clinics for care, you do have the option of asking us for updated at-home test kits. So that is something that we can help provide and replace so that you have access to testing equipment at home. The next question we have is from Carl. Carl, you're on the air, and you can share your question.
Yes, I just got done with the regimen of Paxlovid, and I was wondering, should I get retested now that I'm through with the regimen, or should I remain confined for a few more days?
Dr. Hildebrand again. So, Carl, that's a very interesting and confusing question. But suffice it to say that the CDC recommends that you stay isolated for at least 24 hours after the resolution of your last symptom. Now, if your last symptom was loss of taste or loss of smell, that could take a long time to come back. So that's off the table. But any other symptoms such as shortness of breath, fever, cough, feeling poorly, you should wait at least 24 hours after the resolution before you would re-engage in society. Ideally, you would be wearing a mask for at least 14 days from the first day you were positive, just to ensure safety for everybody around you. But after 14 days, you should be safe. Now, the only caveat to that is if you have severe diseases that you have to take medicines to control your immune system, such as prednisone or rheumatology medicines or cancer treatments. In that case, you need to talk to your primary care or to your specialist what the recommendation would be. Finally, the last part of that question was about retesting. You could be positive for a very long time, but not transmit the virus to anybody. So the recommendation is not to retest because it's going to be an erroneous result likely. So symptom-based.
Thanks, Dr. Hildebrand. I know that those isolation precautions are confusing for a lot of people, so that's a question that commonly comes up. But it's good to isolate for an extended period of time to make sure that you're not passing it on to other folks.
And I do recommend our listeners access the CDC website. It's very easy to use and very comprehensive and very trustworthy with the most up-to-date information we have available about the virus.
Thanks, Dr. Hildebrand. The next caller we have is Douglas. Douglas, you have a question about your brother.
Hi, my name is Doug, and I have a brother that will not take the shots or anything, and he says that people are dying. I tell him people are dying from COVID, and then he says, from COVID or with COVID? How do I answer that?
Dr. Hildebrand again, Doug, I think that's an excellent question. I think it's very hard to convince people to do something that they're sort of not bought into. And I think if the question really is, do people die from COVID? The answer is yes. It's not as often as it was a year ago, but it's still happening. And the bigger problem is that even if you die with COVID, the other diseases that you have are made significantly worse by COVID, so that there's no being off the hook with an exposure to COVID, I think is the bottom line. I think people who care most about the health and the health of the people around them are going to test themselves and to protect themselves regardless. It's almost exactly like the flu, same story as the flu. So I don't know if that helps or doesn't, but that's the way I sell it to my patients.
All right, thanks, Dr. Hildebrand. The next question is from Connie, who has a question about caregivers.
Yes, I remember back when folks were going through the series and the initial COVID booster, it was opened up to VA Caregiver Support Program caregivers. And I'm just wondering if that's going to be the case with the upcoming booster that's now authorized.
Hi, Connie. This is Stephanie from Social Work. My understanding, and everybody is confirming that in the room, that the COVID boosters will be available for the veterans caregivers. So please make arrangements with the information that Christy provided earlier to get your COVID booster, because we really need the caregivers to stay healthy to help care for our veterans. So great question, and we definitely appreciate you.
And we do definitely appreciate you, Connie. It's nice to hear your voice on this call, too. Excellent question. We have a question from Diane on the PACT Act.
Hi, this is Diane. I wanted to ask, the Vietnam-era veterans, are they included in this list of veterans that should be screened? My husband is working towards getting on board with his health care through VA. He was in the service in that area, and there's no doubt in my mind that he was exposed to several different things that could have caused the cancer that he's got, but the doctors will not commit and say, yes, this did it, this did it. I get it. And I heard you say something about time frame, Gulf War and post 9/11. I am aware that there was a lot of toxic exposures to those people. I get it. I want to find out, how do I find out how many different, who qualified?
Yeah, so that's a great question, Diane. And as we've been referring back to the VA website at www.va.gov, there is a specific location where you can click under healthcare resources for information about the PACT Act, and there are expanded eligibilities for Vietnam-era veterans to allow them to enroll in VA healthcare, and presumptive conditions that also apply. So I don't know, Stephanie, if you have something to add.
Yeah, and then I just usually, again, this is Stephanie from Social Work, I usually recommend that veterans and their families work with their county veteran service officer. There are a wealth of information in terms of what kind of disabilities are considered presumptive through the VA, and then also can help you file claims. And so if you live in the state of Wisconsin, everybody should have a county veteran service officer. I know Northern Illinois has contacts as well. So just keep that in mind as an additional resource for you to help get the benefits that you deserve.
That's a great question and a timely one, given all of the new information about the PACT Act. And I think a great reference to go to your county veteran service officer, because they can really help work with you and advise you about eligibility for your husband. So thank you for sharing that. Our next question is from William from Rockford. William, if you have a question or comment, we'd invite you to share it.
Oh, yes. I'm wondering, how do I get my past medical records? I've gone through the archives, and they're unable to find them. And I was just curious, what more can I do in order to relocate my past medical records?
William, can you clarify, are you looking for your military records or your medical records?
My military medical records that I had when I was in Korea, and I was worked on over there in the field, and and it doesn't show on my DD service record. So what I'm looking for is my past medical records from Korea.
Okay, thank you for that question. I'm Pam, and I'm with the eligibility office here at the VA hospital. I think it was mentioned earlier that a wonderful resource for you to go to is your local county vet service office. They have a form that they can fill out for you, and it can also be requested online to the National Archives through your branch of service. That would be how you would go ahead and request that type of documentation.
Thank you very much for the question. Our next question is from Richard, who has a question about availability of care at our Rockford clinic.
Hello. Yes, I was just, I have growing concern whenever my allergies effectively pick up or I have a need to see someone at the Rockford clinic. The availability hasn't been there like it once was. And I also recall many years ago reading about having the chiropractic / acupuncture and massage therapy benefits, but that seems to be going through the community care, so I have to keep on bothering the primary care in order to have a better quality of life and mobility due to the injuries I sustained. That seems to be something that does help greatly for myself. And I guess that would be the main two things right now. I'm curious to understand. I spent 6.5 hours over at the urgent care because that's where I was directed to go at the hospital there, just so I could get an antibiotic, and my ear got plugged up. So they did a slight ear flush, which didn't really help. Tried to pick some of it out, but anyway.
So this is Dr. Hildebrand. I'm sorry to hear about your difficulties. I guess I'm a little perplexed as our numbers would suggest that we do have availability, and I guess we can certainly get your information and look deeper into why you're not able to see your doctors at the Rockford Clinic. There is not an urgent care in Rockford. The closest urgent care is in Madison, and that's why the community care has now authorized urgent care and emergency room visits in the community for patients who are too far away from the main facility. The issue with chiropractic and acupuncture really boils down to, can we find a provider who'll work at the VA? Do we have enough space? And are we able to provide a service that's consistent with what the community would provide? And through the Congressional Act that allows us to send patients to the community, it does have to start with a consult to primary care. So that is unlikely to change. But I'm suffice to say that we're happy to speak with you offline and try to figure out why you're unable to access the care that you need and deserve.
Thank you very much for that question. The next question we have, we're trying to get it up here, is from Roger, who has a question about his booster shot.
Hi. Oh.
Go ahead, Roger. You're on the air.
Hello?
Yes, we can hear you, Roger.
Yeah, I'm sorry. Okay. I'm coming up to the Gainesville Outpatient Clinic on October 5th for lab work. Can I get my third Moderna shot at that time? Or do I have to call and make a special arrangement?
Hi, Roger. This is Christy. It would be good if you can call and make an appointment just to be sure that we're ready for you when you arrive. So you can call that 608-280-2826. 2160 number to get scheduled.
Okay, I need that phone number again.
I'll repeat it. 608-280-2160.
And that's just a great reminder for everybody on the phone. Our vaccine hotline for COVID vaccine is 608-280-2160. And we'd be anxious to take your calls and set you up with an appointment at a time that's convenient for you. Okay, our next question comes from Thomas from Beaver Dam. Thomas, you have a question about your COVID shot.
Oh, is this me?
Yes. If you're Thomas, we have you on the line here. Please share your question.
Well, I have 3 shots so far for COVID, and on Labor Day, I tested positive for COVID and had a mild case of it, and I'm pretty well recovered. My question is, how soon can I get the 4th shot, which I want?
Yeah, thank you, Dr. Hildebrand. Again, I think that's a great question. I think that we're asking 6 to 10 weeks post it, and it kind of depends upon your other chronic medical problems, which we obviously can't get into here for privacy reasons. But I would certainly inquire of your care team to say would they recommend. I think the minimum 6 weeks, and for sure 10 weeks is completely safe. So I would probably be waiting a while. And I think good on you for getting that first series. That's probably why you had a mild case. Good for you.
Thank you. That was an excellent question, and I know with the high transmission rates of COVID, there are many that are in that situation. So thank you for sharing that. The next question we have comes from Daniel. Daniel, you have a question about adverse effects.
Yes. Is the VA tracking adverse effects among the people that have been inoculated by the VA and in the larger community, the community at large that have been inoculated?
So, Daniel, this is Christy again. And the VA and community do track adverse effects from any vaccine, whether it's the COVID vaccine or any other type of vaccine. So if you do think you've had an adverse effect, you can contact your care team, and then there's a process that they go through to get that submitted.
Thank you for that question. Our next question comes from Jim in McFarland, who has a question about his community care.
Yes, I went in and had my annual and 5th booster yesterday. The primary care told me that the VA in Madison now has a on-site acupuncturist, which I currently go see one via community care. Am I going to be forced to go to the hospital, or will I be able to continue my treatment with the guy that I have had now for 9 months in trust?
Hi, Jim. This is John from Community Care. That's a great question. The answer to that will come down to the availability of acupuncture appointments here at the VA and a conversation with the rehab chief, and if it's in your best medical interest to continue care out in the community, continuity of care, as well as your mileage or correction, your drive time from the Madison VA for those services. So we can talk offline. If you want to call community care, we can talk offline and take a look at your case.
Thanks very much for that question. We are just calling up the next caller here. Oh, sure. The next caller is Margie from Janesville. Margie, go ahead with your question.
Yes, hi. My name is Margie. I'm talking about my husband, Gary. He was stationed at Camp Lejeune, New River Air Station, for approximately 3 years, and he developed a lot of health issues. He had a stroke, he's had seizures, kidney disease, and there's a lot more from drinking the bad water. He is 100% through the VA, but we were wondering, would he be able to qualify for any more benefits?
Hi, this is Pam from the eligibility office. So your husband is 100% service connected and was at Camp Lejeune exposed to the environmental hazards at that location, correct?
Our station, which was the same water supply.
Okay, and what kind of benefits are you looking for?
Well, it's been on the news for several months now about Camp Lejeune getting.
Oh, okay. So if you're referring to the PACT Act, sir, you will be screened by your provider for a certain group of questions to make sure that we're treating all of your symptoms here at the Madison VA that are related to your exposure at Camp Lejeune. I've seen commercials out there, and that's probably what you're referring to. There are other benefits available, not only for just the service member, but family members as well. And I would highly encourage you to go back to your local county vet service officer for that vast array of other benefits that might be available.
Thanks so much. And as always, and mentioned before, a great place to go with specific questions about benefits and healthcare eligibilities or county veteran service officer, because they can look at the details of your case and advise you very specifically about how any of these changes could impact either your healthcare eligibility or your eligibility for benefits. So do look them up for your county and do consult them. That is what they're there for. And they can help make sure that we're connecting with you appropriately and giving you the benefits and services that you've earned. Our next question is from Clarence.
Yes, appreciate being able to talk to you guys. And this is a question that's it's really not medical at all. It's about honor flights and the availability or who's available. And I served in Berlin towards the latter years of the Berlin crisis from like 62 to 65. And then also my father was killed in World War II in Florence, Italy. And I just
Hi, Clarence. Oh, go ahead.
If there's a number that you could give me where I could check on something like that, or and I know it has nothing to do with the medical. I understand that, but maybe some other people would be interested in this too.
Thanks, Clarence. Kind of depends on where you live. If you live in Wisconsin or Illinois, because different areas have different honor flights. In the Dane County, Madison greater area, we have the Badger Honor Flight. And so I can give you the information for Badger Honor Flight, but really, if you're computer savvy, you'd be able to figure out the phone numbers for the other places, because I know like the Milwaukee area has different honor flights, and so does the greater La Crosse area there on the west side of the state. But the Badger Honor Flight is the one that is in our area, and they have an organization, and their phone number is 608-616-0243. That's 608-616-0243. And they also have a website, badgerhonorflight.org, that has a lot of information, a lot of frequently asked questions, and then their applications have links on that website also. So I know a few folks that have had the honor to go there, and a lot of other folks who have been the guardians on the flights, and it's a really great experience. So encourage folks to definitely get hooked up with that if they're interested in volunteering. It's separate from the VA, like you said, but definitely worth your while to check into. So great question, and I agree there's probably a lot of people who would be interested in that.
Yeah. Thank you very much, Stephanie, and thanks, Clarence, for that question. The next question we have is from Michael in Baraboo. Michael, go ahead with your question. Michael, are you on the line? Do you have a question about community care? Okay, well, Michael's not on the line, but we'll read his question because we can do that here. He had a question about urgent or emergency care. When a veteran goes to urgent or emergency care outside the VA, there's a phone number that you're supposed to call in order to notify us that you've been to the emergency room. Michael's question is, can you submit the information online somewhere instead of making a phone call? It's a good question.
Michael, that is a great question, and this is John from Community Care. So urgent care and emergency room visits are handled a little different depending on which type of care you're receiving. Urgent care visits are handled directly between the vendor that you're seeing and the VA's third-party contractor. They're to call, verify your eligibility, and get that authorization at the time you present to urgent care. For the emergency room visit, once you are in the emergency room, you have 72 hours to call and notify the VA. You can call your local VA facility, be it Madison, Milwaukee, or Toma, or you can call the national 24-hour number at 844-724-7842. Again, that's 844-724-7842, and you can let them know where you're being seen and for what medical concern you're having. And the medical providers there have the ability to send that notification as well to the VA via an online submission form. The facility has that information on hand in their emergency room. And we can give you that information if you visit the Mission Act website. They have the information on there regarding where to submit that notification to.
Thanks, John. Okay, we're queuing up the next question here. I think we have time for a few more. As we're queuing up the question, just want to, again, thank you. We've had a lot of questions here today and really appreciate everyone sticking on the line with us and staying in the queue to hear answers to these questions and to join us for our telethon hall. So the next question we have is from Donald in Rockford. Donald, you're on the air.
Hi, sir. I have a question about community care, which I really appreciate to begin with. It seems like you community care steps up to see a doctor, so that takes about 6 weeks. Then a doctor recommends physical therapy. That takes another 6 weeks. Then you give you medicine, and then you give you injections, and by the time you go see the doctor again, your 6 months is ran out, and then you got to start all over again. I'm confused on this.
Hi, Donald. Great question. So National, when they created the community care and the guidelines for the various cares out in the community, in your particular case with the physical therapy, the injections, not every patient's care is the same and requires the extensive workup that it sounds like you're having. So they do set it at a 6-month time frame, and if you need extended care, have that conversation with your primary care provider. They will review the situation, put another consult in, and that care can be continued so you don't have any lapse in that care out in the community. But it is a set timeline by National VA that we here at the local facility cannot change.
Thanks, John. Appreciate that, and sorry for any inconvenience that causes to you. We do want to make sure that we're getting you the care that you need at the time that you need it. The next question we have is from Ron in Beaver Dam. Ron, you have a question about compensation?
Hello. When I was in Germany in 64, 65, 66, and 67, I was a front-end loader operator, and we had to go on a training deal one day, and the Germans turned the heat off on our train, so we were starting out cold to begin with, and we road marched from sun up until 10:30 at night, and no stopping for hot food or coffee or anything, and my legs were so cold that I couldn't even stand up when we got to the end of the ride. And now my legs, they don't work worth a darn. I can't stand more than 15 minutes at a time. And I'm kind of wondering if there's any compensation I can get out of this. When I do get up and walk around, I got to walk over to my wheelchair and run around with that.
Thank you so much. This is Pam again from the eligibility office. And it sounds to me what you're talking about is just a classic example of those type of things you would file for a service-connected disability for if you're talking about compensation. I would, again, refer you to your vet service office that can assist you with filing the paperwork and following your claim through. And if awarded the service-connected disability, you would not only receive compensation for that injury, but we would acknowledge it with your health care and apply that to your health care priority group benefits as well.
I think we have time for one more question. And our question is from Robert. Robert, you have a question about My Healthy Vet?
Yes, sir. I have tried to sign up for My Healthy Vet on numerous occasions, and it seems that they keep changing the rules on it instead of having one set sign up. There's 6 or 7 different ways that call for you to keep changing your password and such. And I'm 78 years old. Why do I have to keep changing?
Well, I think we can all sympathize with that kind of question. Even those of us who are a little younger than 78 get frustrated by the same thing. But Stephanie, do we have a place to point?
Yeah. Hi, Robert. It's Stephanie. I don't know if you ever have the opportunity to get down to the hospital here to the main building, but the PERC, which is our Patient Education and Resource Center, is a really great walk-in area where they have folks there who can help people get signed up for My Healthy Vet and then also kind of help them work through in real time the computer and getting it signed up. I do know that My Healthy Vet went through some security changes recently, and it's unfortunate that everything these days needs to have 2-factor authentication. But it's really meant to keep your private information private. So I don't know. I have the phone number here, and there's a 1-800 number, which is 877-327-0022. That's a help desk number. But then also we have a local extension. So if you dial the main hospital number here, the 608-256-1901, you can dial extension 17173. 17173. And we have an employee that their job is to figure out My Healthy Vet for everybody. So it's a great resource. So I hope that helps you. But yes, it can be complicated.
Yeah, and for any of, if you didn't get that number, the other thing that you can do that might be easy to remember is just if you call our main operator number and ask to get connected to the PERC, or the Patient Education Resource Center, they should be able to handle that question and connect you with somebody who can help you with any technical issues around My Healthy Vet. But as we get more technologically, I don't want to say savvy, because sometimes it seems like technology takes us backwards, but over time, these systems will improve your access to your health information and your ability to access services through the VA. Well, I really want to just say thank you to all of you for joining us today. We are running up on 1 o'clock, so we appreciate all of the questions that we got. If we didn't answer your question, please stay on the line, because in a moment you'll have a chance to leave a voicemail with that question, any comments or any feedback that you have. Before we close today, we do want to remind everyone that September is Suicide Prevention Month, and we're reminding veterans everywhere that suicide is preventable and there is hope. Reaching out for help is not always easy, but veterans are trained to do hard things. So don't wait and reach out. If you're a veteran or you know a veteran who needs support, visit www.va.gov/reach for support and resources relevant to your needs. We also want to remind everybody that the Veterans Crisis Line number did change to a new shorter number. If you didn't hear that at the beginning of the call, that new number is 988, then press 1 if you're a veteran. So again, that Veterans Crisis Line number, which is available 24/7, 365 days a year to provide confidential crisis support, can be accessed by just dialing 988 and pressing 1. We really want to thank all of you for being with us today. Thank you for your questions. It's wonderful to connect with anyone, and we do these town halls quarterly, so we'll look forward to having you participate in a future town hall, and look out for updates from us on our Facebook page or through our newsletter. We're so happy to serve you, and thank you for your time today.